Which first-generation antipsychotic has the greatest dopamine D2 receptor affinity and therefore the highest risk of extrapyramidal symptoms? Haloperidol. Remember, halo holds dopamine too tight. Which atypical antipsychotic is superior for treatment-resistant schizophrenia but requires weekly absolute neutrophil count monitoring? Speak, prosody rate, clozapine. Remember, clozapine counts neutrophils weekly. Name the life-threatening adverse effect characterized by hyperthermia, muscle rigidity, autonomic instability, and elevated creatine phosphokinase that may occur with high-potency antipsychotics. Neuroleptic malignant syndrome. Remember, hot, stiff, mad, bad. Which medication is first choice for the pharmacologic management of acute dystonia induced by antipsychotics? Steep prosody rate 100%, intramuscular benztropine. Remember, benztropine bends the spasm. Which atypical antipsychotic has the highest propensity to prolong QT interval and therefore requires baseline and follow-up ECGs? Ziprasidone. Remember, ziprasidone stretches the beat. Blockade of which dopamine pathway is primarily responsible for antipsychotic-induced prolactin elevation? Tuberoinfundibular pathway. Remember, tube-to-breast pathway. Which long-acting injectable formulation of an atypical antipsychotic can be given once every 3 months after loading doses? Speak, prosody rate 100%, paliperidone palmitate 3 monthly, prosody. Remember, paliperidone plays the long game. Which antipsychotic is preferred in Parkinson's disease psychosis because it has minimal D2 antagonism? Clozapine or pimavanserin? NEET PG accepts clozapine. Remember, clozapine spares shaky dopamine. Among atypical antipsychotics, which one is associated with the greatest weight gain and metabolic syndrome risk? Speak, prosody rate 100%, olanzapine. Remember, olanzapine orders late pizza. Which first-generation antipsychotic possesses strong antimuscarinic activity and therefore has lower risk of acute dystonia but higher anticholinergic side effects? Speak, prosody rate 100%, chlorpromazine. Remember, chlorpromazine dries mouth wide. The atypical antipsychotic aripiprazole acts as a partial agonist at which dopamine receptor subtype? Speak, prosody rate 100%, D2 receptor. Remember, aripiprazole dances half steps. Which serious adverse effect, unique to clozapine besides agranulocytosis, necessitates immediate drug discontinuation if absolute neutrophil count is still normal? Myocarditis. Remember, clozapine can hurt heart. What drug class is most effective for treating antipsychotic-induced akathisia? Beta blockers such as propranolol. Remember, beta blocker calms restless legs. Which antipsychotic has the lowest risk of lowering seizure threshold and is thus preferred in patients with epilepsy? Haloperidol. Remember, halo safe for sparks. Which atypical antipsychotic has the least metabolic side effects and is considered weight neutral? Speak to prosody, rate 100%. Ziprasidone or lurasidone. Remember, ziprasidone keeps genes fit. Which receptor blockade is primarily responsible for orthostatic hypotension seen with low-potency antipsychotics? Alpha-1 adrenergic receptor blockade. Remember, alpha-1 knockdown. Speak, prosody rate 100%. Which antipsychotic carries a boxed warning for impulse control disorders including pathological gambling? Aripiprazole. Remember, aripiprazole bets the farm. Most antipsychotics are metabolized by which hepatic cytochrome P450 isoenzyme that can be inhibited by azole antifungals? Speak, prosody rate 100%. CYP3A4. Remember, 3A4 clears crazy pills. Which antipsychotic is preferred in pregnancy due to the most extensive safety data? Haloperidol. Remember, halo safe for bump. Speak, 100%. Name the dopamine antagonist antiemetic that can precipitate acute dystonia in children shortly after administration. Metoclopramide, prosody. Remember, metoclopramide twists neck quick. Which molecular mechanism distinguishes second-generation antipsychotics from first-generation drugs leading to lower extrapyramidal symptoms? Higher serotonin 5-HT2A than dopamine D2 antagonism. Remember, more serotonin, less dopamine squeeze. Which atypical antipsychotic is indicated for bipolar depression and has high affinity for serotonin 5-HT7 receptor? Lurasidone. Remember, lurasidone lifts bipolar blues. What is the minimum absolute neutrophil count threshold below which clozapine must be stopped according to international guidelines? Less than 500 cells per microliter. Remember, below 500, stop clozapine. Name the ocular adverse effect classically associated with chronic chlorpromazine therapy. Corneal and lens deposits. Remember, chlor blue cornea view. Which antipsychotic has partial agonism at dopamine receptors and therefore causes minimal prolactin elevation, making it suitable for hyperprolactinemia? Aripiprazole. Remember, aripiprazole keeps prolactin low. Which antipsychotic is notorious for severe photosensitivity reactions and skin pigmentation on sun exposure? Chlorpromazine. Remember, chlor sun burns purple. Tardive dyskinesia is thought to result from upregulation of which dopamine receptor subtype in the nigrostriatal pathway? Speak, prosody, rate 100%. D2 receptor supersensitivity, prosody, speak. Remember, too many D2 dance later. In neuroleptic malignant syndrome, which dopamine agonist can be given orally or via nasogastric tube as specific pharmacologic therapy? Bromocriptine. Remember, bromocriptine brings dopamine back. Which atypical antipsychotic is available as a sublingual formulation to achieve rapid systemic absorption, avoiding first-pass metabolism? Asenapine. Remember, Asenapine under tongue, quick calm. Which antipsychotic shows highest affinity for histamine H1 receptors, explaining profound sedation and weight gain? Quetiapine. Remember, quetiapine quiet and heavy. Which antipsychotic is preferred in elderly delirium because of potent D2 blockade with minimal anticholinergic effect? Haloperidol. Remember, halo handles hospital confusion. What is the typical time of onset in hours for acute dystonia after initiating high-potency antipsychotic therapy? Speak. 4 to 48 hours. Remember, dystonia day 1 drama. Which antipsychotic may improve negative symptoms of schizophrenia through higher serotonin antagonism and partial dopamine agonism? Aripiprazole. Remember, aripiprazole adds motivation. Rabbit syndrome. Remember, rabbit nibble around mouth. Which depot first-generation antipsychotic preparation is administered every 2 to 4 weeks in sesame oil using Z-Track technique? Haloperidol decanoate. Remember, haloperidol depot deep shot. Which antipsychotic, when combined with lithium, increases risk of neurotoxicity and should be monitored closely? Haloperidol. Remember, halo plus lithium, shaky combo. Which cytochrome P450 enzyme primarily metabolizes clozapine and is induced by smoking, leading to lower clozapine levels? Speak. Prosody rate 100%. CYP1A2. Prosody. Remember, 1A2 burns clozapine faster. What is the recommended interval in months for baseline and follow-up fasting lipid profile while using olanzapine? Every 3 months in first year, then yearly. Remember, lipids check 3 monthly start. Which atypical antipsychotic is approved for irritability associated with autism spectrum disorder in children? Risperidone. Remember, risperidone reduces raging kids. Which antipsychotic can cause cataracts with prolonged high doses, necessitating baseline and annual slit lamp examination? Speak. Prosody rate 100%. Quetiapine. Remember, quetiapine clouds lens slowly. Name the calcium channel blocker sometimes used to treat neuroleptic malignant syndrome refractory to bromocriptine. Dantrolene. Remember, dantrolene cools rigid muscles. Which antipsychotic is available as an inhaled powder for rapid treatment of acute agitation in schizophrenia? As speak. Loxapine inhalation. Remember, loxapine puff, calm, quick. Hyperglycemic ketoacidosis has been reported most commonly with which second-generation antipsychotic? Speak. Prosody rate 100%. Olanzapine. Remember, olanzapine overloads sugar. Which atypical antipsychotic needs administration with at least 350 calories of food to ensure adequate absorption? Speak. Prosody rate 100%. Speak. Remember, lurasidone loves lunch. Identify the dopamine pathway whose blockade results in therapeutic decrease of positive symptoms of schizophrenia. Speaking prosody, rate 100%. Remember, limbic lounge quiet now. Which antipsychotic has demonstrated efficacy in preventing suicidality in schizophrenia, independent of symptom control? Clozapine. Remember, clozapine cuts suicide risk. Which antipsychotic can be administered as a once-yearly subcutaneous depot formulation of its active metabolite? None currently yearly. Longest is olanzapine pamoate every 2 months. Answer, not available. Remember, no antipsychotic yearly yet. What is the preferred first-line treatment for tardive dyskinesia, according to recent guidelines? VMAT2 inhibitors such as valbenazine. Remember, valbenazine vanishes vectors. Which first-generation antipsychotic has significant H1 and muscarinic blockade, leading to high sedation and hypotension, but low EPS at usual doses? Thioridazine. Remember, thioridazine thick pillow dreams. Which cardiac arrhythmia may be precipitated by intravenous haloperidol in susceptible patients? Speak, prosody rate, 100%. Torsades de points. Remember, haloperidol twisty tachycardia. Which metabolic enzyme genetic polymorphism causes poor metabolism of risperidone, leading to higher risk of EPS? Speak, prosody rate 100%. CYP2D6 poor metabolizer status. Speak. Remember, 2D6 slow risperidone. Which atypical antipsychotic shows partial agonist activity at serotonin 5-HT1A receptors, contributing to anxiolytic effect? Ziprasidone. Remember, ziprasidone soothes social fear. Which antipsychotic should be avoided with fluvoxamine because of potent inhibition of its metabolism leading to toxicity? Speak, prosody rate 100%. Clozapine. Remember, fluvoxamine fattens clozapine level. Which antipsychotic has the greatest risk of retinal pigmentary deposits, especially at high cumulative doses over years? Thioridazine. Remember, thioridazine tints retina brown. What injectable combination is administered for rapid tranquilization of a violent psychotic patient in emergency when IV access is unavailable? Haloperidol and promethazine intramuscular. Remember, Halo plus Pro calms crash. Which antipsychotic displays inverse agonism at serotonin 5-HT2A receptors and acts as sleep aid in low doses due to antihistamine effect? Quetiapine. Remember, quetiapine, quiet night. Which long-acting, injectable second-generation antipsychotic must be followed by oral supplementation for 3 weeks after first injection to maintain plasma levels? Aripiprazole monohydrate long-acting. Remember, aripiprazole need pill bridge. What is the minimum clozapine plasma concentration in nanograms per milliliter associated with clinical response? 350 nanograms per milliliter. Remember, 350 moves mind. Which first-generation antipsychotic is classified as a low-potency agent but still causes significant EPS at higher doses and potent antiemetic effect. Prochlorperazine. Remember, prochlorperazine cukes prevention. Which antipsychotic can raise serum transaminases and cause hepatotoxicity, demanding periodic liver function monitoring, especially in pediatric use? Speak prosody rate 100%, risperidone, prosody. Remember, risperidone rattles liver. Which antipsychotic has highest risk of obsessive-compulsive symptom exacerbation owing to potent serotonergic activity? Clozapine. Remember, clozapine crafts compulsions. Speak, prosody rate 100%. Name the long-acting injectable formulation of olanzapine associated with post-injection delirium sedation syndrome requiring 3-hour observation. Speak, prosody rate 100%, olanzapine pamoate depot. Remember, olanzapine depot dreamy danger. Which atypical antipsychotic least likely to elevate prolactin is useful in patients experiencing galactorrhea on risperidone? Speak, quetiapine or aripiprazole. Speak right. Remember, quetiapine keeps milk low. Speak. Which antipsychotic combination should be avoided due to additive QT prolongation and risk of torsades de pointes? Speak. Haloperidol, ziprasidone. Remember, zip plus halo twist worse. Which antipsychotic antagonizes dopamine and serotonin but also acts on glutamate NMDA receptors, indirectly proposed to improve cognition? Speak prosody rate 100%. Clozapine. Remember, clozapine crosses glutamate gate. Which oral formulation of risperidone uses microencapsulation to allow once-daily dosing with smoother plasma levels? Risperidone controlled-release tablet. Remember, risperidone smooth ride. Name the endocrine side effect caused by dopamine blockage leading to menstrual irregularities and galactorrhea. Hyperprolactinemia. Remember, high prolactin makes milk. Which antipsychotic is linked to dose-related pigmentary retinopathy and therefore requires periodic ophthalmic evaluation, especially above 800 mg daily? Thioridazine. Remember, thioridazine paints retina. Which muscarinic agonist is under investigation to balance cognitive side effects when combined with antipsychotics? Speak, xanomeline. Remember, xanomeline sharpens mind. Which antipsychotic is most suitable for delirium tremens complicated by psychosis because it does not lower seizure threshold significantly? Haloperidol. Remember, haloperidol handles booze brain. Which antipsychotic has an active metabolite 9-hydroxyrisperidone which is available as a separate drug, paliperidone? Speak, prosody rate 100%, risperidone, end quote. Remember, risperidone parent to paliperidone. Which antipsychotic was first to be described as having efficacy in treatment of Tourette disorder tics? Imazide. Remember, pimazide quiets tics. Which antipsychotic combination is rationally avoided as both drugs are D2 antagonists, increasing risk of EPS without added benefit? Haloperidol plus risperidone. Remember, two blockers double stiffness. What daily dose threshold of chlorpromazine equivalents defines high-dose antipsychotic therapy in adults? More than 1,000 milligrams chlorpromazine equivalents per day. Remember, beyond 1,000 high-dose land. Which centrally acting anticholinergic other than benztropine is commonly used for prophylaxis of extrapyramidal symptoms in India? Speak. Prosody rate 100%. Trihexyphenidyl. Remember, trihexyphenidyl tames tremor. Which genetic polymorphism of dopamine receptor is associated with better clozapine response in treatment-resistant schizophrenia? Speak. Prosody rate 100%. DRD2 TAC1A1 allele absence. Remember, good response, no A1 tag. Which atypical antipsychotic is preferred in hepatic impairment because it undergoes minimal hepatic metabolism and is excreted unchanged in urine? Speak. Prosody rate 100%. Paliperidone. Remember, paliperidone passes through unchanged. Which antipsychotic has dopamine D3 preferring antagonism and is used off-label for substance use disorders research? Cariprazine. Remember, cariprazine chases craving. Which serious blood dyscrasia other than agranulocytosis is associated with clozapine and mandates discontinuation? Eosinophilia greater than 3,000 per microliter. Remember, high eosinophils help clozapine. Which partial dopamine agonist can precipitate psychosis if given to a patient regularly taking haloperidol due to receptor competition? Speak. Prosody rate 100%. Bromocriptine or levodopa. Speak. Remember, dopamine giver breaks block. Name the antipsychotic that can be used once daily at night owing to its long half-life and aids sleep in schizophrenia. Quetiapine extended release. Speak. Remember, nicotiapine quiet stay. Which antipsychotic is safest in glaucoma because of minimal anticholinergic activity? Haloperidol. Remember, haloperidol harmless to eye pressure. Which serotonin syndrome triad can also occur from combining MAO inhibitors with atypical antipsychotic ziprasidone due to serotonin reuptake inhibition property? Mental status change, autonomic instability, neuromuscular hyperactivity. Remember, mind-heat clonus trio. Which atypical antipsychotic needs dose reduction when co-administered with diltiazem, a moderate CYP3A4 inhibitor? Quetiapine. Remember, quetiapine quantity drops with diltiazem. Which antipsychotic is preferred for comorbid depression because it is approved as adjunct to antidepressants and has partial D2 and 5-HT1A agonism? Aripiprazole. Remember, aripiprazole lifts mood extra. What is the earliest extrapyramidal symptom appearing usually within hours to days of antipsychotic initiation? Speak. Prosody rate 100%. Acute dystonia. Remember, early twist is dystonia. Which antipsychotic may cause hyponatremia via syndrome of inappropriate antidiuretic hormone secretion, especially in elderly females? Speak. Aprosity rate 100%. Risperidone. Remember, risperidone removes salt. Name the novel antipsychotic acting as D2 receptor antagonist with sigma-2 binding now approved for schizophrenia. Speak. Prosody rate 100%. Lumateperone. Remember, lumateperone light new path. Which antipsychotic requires post-injection observation due to risk of severe post-injection hypotension from rapid absorption? Olanzapine pomoate. Remember, olanzapine observe after shot. Which antipsychotic exhibits preferential D2 blockade in mesolimbic over nigrostriatal pathways via rapid dissociation kinetics, lowering EPS risk? Speak. Clozapine. Remember, clozapine quick off receptor. Which antipsychotic, when given with carbamazepine, shows reduced plasma levels due to potent enzyme induction and should be avoided? Speak. Quetiapine or clozapine, except clozapine, prosody. Speak. Remember, carbamazepine clears clozapine. Name the musculoskeletal adverse effect of long-term antipsychotic use characterized by abnormal bone mineral density due to hyperprolactinemia. Instead, osteoporosis. Remember, high prolactin hollow bones. Speak. Which antipsychotic combination with valproate increases risk of hypothermia, especially in elderly patients? Speak. Risperidone with valproate, prosody, _speak. Remember, risperidone plus valproate chills body. Which antipsychotic is unique for blocking serotonin 5-HT2C receptors, leading to appetite increase and weight gain? Speak. Prosody rate 100%. Remember, olanzapine opens fridge often. Which antipsychotic overdose presents with meiosis, hypotension, and cardiotoxicity similar to tricyclic antidepressants due to membrane stabilizing effect? Iomedazine. Remember, thioridazine mimics tricyclic trouble. Which antipsychotic has highest affinity for D4 receptors and negligible for D2, yet still effective for psychosis? Clozapine. Remember, clozapine digs D4 deep. Which antipsychotic lowers seizure threshold most strongly and therefore requires caution in epileptic patients? Clozapine. Remember, clozapine sparks seizures. Which dopamine pathway blockade by antipsychotics contributes to negative symptoms and cognitive impairment when excessive? Speak. Prosody rate 100%. Mesocortical pathway. Speak. Remember, cortex block blanks thoughts. Which antipsychotic is preferred for acute psychosis in hepatic failure because of predominant renal excretion and limited liver metabolism? Paliperidone. Remember, paliperidone passes liver lightly.